Hello again. I hope you're enjoying this autumn time of year when the beautiful colors of Colorado seem to be at their most vibrant. Fall's a time of thanksgiving and reflection. I think it's a great time to look back on our department's accomplishments this past year. This year we celebrated 2 years of CSTAT, our performance management strategy, that keeps us on track and accountable to create positive outcomes for Colorado. Thanks to your hard work and diligence to meet CSTAT goals, we've made hugely significant strides. Let me tell you about a few. The near elimination of the use of restraint at our Mental Health Institute at Pueblo. A 95% reduction in the use of seclusion at the Fort Logan Mental Health Institute. In the Division of Youth Corrections, we've increased the number of youth leaving DYC with a high school diploma or GED. This year, we're at 94%. And in the Division of Disability Determination Services, our average processing time went from a high of 143 days to below 95 days, while maintaining one of the lowest error rates in the entire country. As a result of another of our wildly important priorities, helping the people we serve to thrive in their communities over the past 2 years, we've transitioned more than 100 regional center clients from Wheat Ridge, Pueblo, and Grand Junction into the community and live in the setting of their choice. Our agency, along with the Departments of Healthcare Policy and Financing and Local Affairs, signed Colorado's first ever community living plan. This plan helps bring Colorado into compliance with the Olmstead decision, and it's focused on helping all Coloradans to be able to live in the most integrated community settings of their choice. The Division of Vocational Rehabilitation has significantly reduced the time from application to eligibility. At the same time, they set new standards for client contact. They know that building a trusting relationship between rehab counselor and our clients is the first step to successful employment. Through Rehire Colorado, a brand new program we created, nearly 450 individuals who struggle to find permanent employment have been placed in transitional jobs that are stepping stones to achieve meaningful, lasting, and fulfilling employment. Yet another of our wildly important priorities. In the past year, we've made major strides in improving Colorado's child welfare system through the implementation of Governor Hickenlooper's plan, Keeping Kids Safe and Families Healthy. For the first time in our state, CDHS has implemented child abuse prevention initiatives like Colorado Community Response, Safe Care, and Nurse-Family Partnership Augmentation. These programs identify children and families at risk for abuse and neglect and provide services before families become officially involved in the child welfare system. On January 1st, we will launch Colorado's first ever statewide child abuse and neglect reporting hotline so that all of us can do our part to protect our most precious resource. The hotline will be enhanced with better prepared reporters. The state's first online training program for professionals who are mandatory reporters of child abuse and neglect went live in July. Remember, as a CDHS employee, you are a mandatory reporter of child abuse and neglect. If you haven't taken the online training, please do so. Along these same lines, Colorado joined 47 other states and now requires professionals who serve our seniors to report suspected physical or sexual abuse, neglect, or financial exploitation. Since mandatory elder abuse reporting went into effect on July 1st, we've received more than 4,000 reports of alleged mistreatment. That's a 51% increase over last year's average number of reports. This year, CDHS has made great progress in improving our behavioral health system through the ongoing implementation of Governor Hickenlooper's strategy to redesign the state's mental health services and support system. He called it Strengthening Colorado's Mental Health System, a plan to safeguard all Coloradans. In August, we launched Colorado's first ever statewide mental health crisis hotline. And now, trained professional counselors are already receiving an average of 225 calls every day. They're providing immediate crisis assistance and support and referrals to community services. Before year's end, we'll work with community providers in 4 regions of the state to roll out the remaining components of Governor Hickenlooper's plan, which will include walk-in stabilization units, mobile crisis response teams, and respite care. And our mental health institutes are leading the nation with the implementation of trauma-informed care in the hospital setting. We're providing better patient care and treatment, as well as utilizing peer specialists, relaxation rooms, and specially trained trauma-informed care staff. And if all this wasn't plenty enough to talk about, Colorado's epic fires and floods forced us to move quickly to help child care providers whose facilities were affected to get open soon for children, to make sure people in need receive their TANF and SNAP benefits timely, and for our agency to work efficiently with other state agencies and the federal government to develop not only short-term plans and strategies that help to get our communities back together, but to stay committed with those communities through the long term as they work to rebuild even stronger communities than before the floods occurred. All of this happened because of you. Governor Hickenlooper and I are deeply appreciative of your efforts to help Coloradans thrive in their communities, to achieve meaningful employment, and to prepare for educational success throughout their lives. Thank you for your dedication to make CDHS the most effective 21st century human services system in the country.